Warm greetings to everyone. I am Dr. Devanathan, consultant pulmonologist from Asthma Studio, Villacheri. Today we will be discussing about a condition known as home oxygen therapy. There is a recent advancement in this therapy. Previously we used to give us a stationary oxygen therapy. Now we have an advancement such as a portable oxygen device. So how it is used we will be discussing in this video today. So a pulmonologist will prescribe an oxygen therapy at home if the oxygen level of the patient is persistently below 88%. So who are all the patients will be requiring us? Commonly those patients with COPD patients. So what happens in COPD, if this is a normal airway diameter, for them in the patients, the airway diameter will be reduced. So in order to maintain the normal oxygen level, your doctor will prescribe you an oxygen device. So traditionally what used to be given as an stationary oxygen device that needs to be connected to electricity. Now what we have an advancement, we have portable oxygen devices that run on batteries. So the next most common condition in which the oxygen device is necessary is an interstitial lung disease, wherein a part of the lung is scarred. The lung tissue is damaged, and in order to compensate for the damaged lung tissue and in order to maintain the normal oxygen level, your doctor might recommend you an oxygen device, home oxygen device. Next condition is known as bronchiectasis. In this, a part of the lung is diseased, and in order to compensate for it, the doctor will again prescribe you a home oxygen device. And another more common condition is in pulmonary hypertension, in which the pressure to the lung, the blood vessel supplying to the lung is high, and for it, the treatment medically, the treatment is an oxygen device. So in all these conditions, the doctor will be prescribing a home oxygen device. So what is now the recent advancement is the previous devices, they need power backup. That is, they needed to be connected to the power supply, and they usually used to be bigger in size. Now we have portable smaller devices that run on batteries so that you can carry them with a backpack. The main advantage is it gives the patient the freedom to mobilize easily. So if the device that needs to be connected to power continuously means the patient are stuck up in a room in a room for a long term. So with portable devices, the patient are able to walk easily. They can easily go down for a walk. So this in turn improves the homeostasis of the patient. It reduces the chance of patient acquiring a bed sore, because if your patient is being given a stationary oxygen device, there are good chances that the patient will be sitting or lying down for a long period of time. With a portable device, the patient is able to go down for a walk, and it improves the mobility of the patient. It improves the psychological well-being, because rather than stuck to a room, the patient is able to go out for a walk, go to places nearby, at least visit the places of pilgrimage that they need to see, or go for social gatherings for a short period of time. So it in turn improves the psychological well-being of the patient. So another major important is hospital visits. Previously, these patients used to be consulted via video conferencing, because it is cumbersome to take the patient along with the stationary device. With the portable device, the patient are easily able to come for regular follow-up, and it's always physical examination is better. And also those who are patients who want to go abroad. So this is very easier to go for in terms of air travel also. In spite of airlines having an air backup, this can this is handy, and patient can have a backup device with them so that they feel confident about going for air travel, or if they want to go abroad to see their relatives or family members. So the main advantage is the mobility it gives. It improves the psychological well-being. Even if the patient needs to go for a smaller pulmonary rehab exercise and all, the exercise capacity is greatly increased with a portable device. Hence, there are newer portable devices such as Ionogen greatly helpful for the patients who are on home oxygen therapy. This is a newer technology that needs to be embraced well. Thank you.